Good morning, everybody. Welcome to another Mancoll Minute. Hope you've had a great week and are staying a little bit cool in these hot days as we're coming in the summer here. A bunch of questions this week, but a little bit change of pace for me. Questions about eyelids. And patient had texted in and said, can I send you a picture? I'm curious if Botox can solve my extra eyelid skin. So let's talk about what Botox does, and then let's talk about eyelid skin as two different things. And the answer to your question is most likely not, okay? If you've got extra eyelid skin, like you see in this picture, kind of hanging over, maybe it's as far down as even touching your lashes, that is not simply a problem because your muscles are too active, okay? Hyperactive muscles, like the ones that cause the wrinkles, that's what Botox does a great job as. It weakens them. It's a neuromodulator. It kind of blocks the receptors so you can't flex those muscles. Now, if you do that in just the right spot on the side, you can get a little elevation of your eyebrow, which can pull this up, and if this is contributing to a little bit extra skin, yeah, maybe it will help. But for the most part, my sense is what that patient is asking me is not a problem of muscles that just need to be relaxed a little bit and pulled up. Is they either have significant brow ptosis that is hanging down, creating that heavy eyelid, and or they've got extra skin, dermochalacia of the upper eyelid. So the answer and treatment for that person most likely is going to be either an upper eyelid surgery called a blepharoplasty, or it could be a brow lift with an upper lid blepharoplasty, depending on which component is contributing the most to that extra skin. And for a lot of my patients, especially those in their 60s, 70s, and older, it's actually never just one component, it's almost always both. Just taking the extra eyelid skin is a reasonable treatment, but keep in mind you're not solving the underlying problem if your brow is low and you don't elevate that as well. Now, sometimes this can be covered by insurance if you can demonstrate visual field obstruction, meaning when you go to the eye doctor and they check your visual fields and you can't see out here where my fingers are. Then sometimes it's purely cosmetic and it's just how things look, particularly in sort of younger folks. And remember, we start to see aging around our eyes in our 30s. Some people a little later than that, but for most people it will start somewhere in their mid-30s. So it is not just something that your grandparents got or your parents get. So to come back to the original question, can Botox treat it? Most likely not. This is most likely a surgical problem that does have some pretty awesome solutions, and it can make you look less tired, more well rested. It's a great operation for kind of opening things back up. Instead of people keep saying to you, gosh, you look tired, you need a vacation, and when you feel like you just got back from one, that's sort of the main wow for your surgery is that open-eyed look. So hopefully that answered the question for you. Talk to you next week.